Buckingham Palace has announced King Charles will undergo a procedure to correct his enlarged prostate next week. They say it is benign. Here now, Dr. Chris Pernell, public health physician and regent at large for the American College of Preventive Medicine. Good to see you as always. Let's begin with what causes an enlarged prostate.
Hi, Marni. So we're talking about a condition that is benign, and when the prostate begins to have excessive growth, which we tend to see in men who are in older ages. So by the time that you reach 60, approximately 50% of men may have BPH, as it is known, and by the time that you reach 85, as many as 90% of men could have BPH. So there is this excessive growth that's happening. I think what's most important for people to know are the symptoms that are associated with BPH. So that's that excessive urination or going multiple times during the day, especially at night. It could be a weak urine stream, difficulty stopping or even starting initiation of that stream.
And if left untreated, what are the risks of an enlarged prostate?
So as the prostate enlarges, the body tries to compensate. So the bladder tries to compensate and push the urine beyond the prostate gland. But the longer that that remains, you can begin to have urinary tract infections. You can have delayed emptying of the bladder. So you have urinary retention. You can even get stones in the bladder. And if a person isn't able to produce urine, then you can start to see damage to the kidney.
People often ask about treatment. We don't know what his treatment will be, but the options are surgery, medication. What else?
Usually doctors start with medications. There are a host of different types of medications that are on the market for those who have what is described as mild to moderate symptoms. If those symptoms progress, especially if a person is starting to have urinary retention, damage to the kidneys, or even blood in their urine stream, is when you start to think about surgical procedures. And a TURP is one of the more common types of surgical procedures, or laser prostate surgery.
Anytime a high-profile person shares a personal medical condition they're dealing with, it helps to raise awareness. I hope that it does in this case. What's the message you hope the King's condition means for the public in getting treatment, getting screenings?
In particular, that we begin to have more open conversations about reproductive health for those who identify as men, because as you age, the risk of developing this benign condition definitely increases. It is so common among men, and it's about a quality of life. People who are struggling with these urinary symptoms or even frequent infections or stones or blood, we want them to know how to get treated and how those treatments may progress.
There is some news on colon cancer that is alarming, and I think a lot of reports are indicating this, but deaths among younger men and women are on the rise for colorectal cancer. Do we know why that is?
Marni, we don't have a specific understanding of what's happening, but we do have some speculations. And when I say speculations, based off of what we're seeing in the data, there are thoughts, could this be due to rising rates of overweight and obesity? Could it be due to the fact that so many Americans and Westerners live sedentary lifestyles? Is it the diet that we're eating? And finally, is there some toxin in the environment? Because we are seeing rising cases and even mortality in those who are otherwise healthy and fit.
And the longer you wait to get screened, the harder it is to catch, and then it'll be in a later stage once it is caught. Real quickly, I'm out of time, but what age should people be getting the colonoscopies now?
Right now, the recommendation is that 45 is the age that everyone should be having their first colonoscopy, unless you have history of colon cancer in your family, especially someone developing colon cancer before the age of 50. You probably should consider 40.
All right. Dr. Chris Pernell, as always, thank you. Important information on a number of topics. Coming up next, we have some new details.